Almost as if every Republican presidential candidate has a playback button in the middle of their chest, the phrase repeal Obamacare has become either a mantra or just another phony talking point. Frankly, America's tired of the snow job, and they want to hear some real answers and alternatives. So do the doctors. Oh, but don't hold your collective breath. Welcome back to former Lieutenant Governor of the state of New York and now Senior Fellow at the London Center for Policy Research, Betsy McCaughey, and on the front lines forced to deal with the madness that is the current healthcare system. Author of Big Medicine, The Cost of Corporate Control and How Doctors and Patients Working Together Can Rebuild a Better System, Dr. Elaina George. Ladies, I thank you both for being here. And Betsy, I'm going to begin with you. Scott Walker has a brand new Obamacare replacement plan. Marco Rubio's got one. But wait a minute. If you look deep into these, the critics are already saying this is nothing more than another entitlement plan, and none of these are going to work. They're not serious opportunities and options here. Agree or disagree?
Oh, you're absolutely wrong about that. All of these plans, and I've looked carefully at them, do four important things. They offer tax breaks to people who don't get health insurance on the job. That levels the playing field. Everybody's paying with pre-tax dollars. They allow people to buy whatever kind of health insurance they want rather than the one-size-fits-all government-designed plan, which Americans are currently forced to get. They allow you to buy health insurance anywhere you want, not just in the state where you live, or not buy it at all, eliminating the individual mandate. And of course, they help people with pre-existing conditions, something that Americans have decided is very important. And most importantly, they all eliminate the employer mandate, so suddenly employers will feel free to hire. We need jobs in this country.
Okay, but here's the thing about Walker's plan. The tax credits are going to be based on age, not income. And immediately you've got people firing back and say that that is nothing more than another entitlement program.
No, it is not. Those tax credits even out the playing field because people who get their health insurance on the job are already getting a huge tax benefit. This just makes it fair for everybody.
All right, Dr. George, let me get to you. You and I have had this discussion many times back and forth, and I, as a patient of a doctor, am sick and tired of watching my doctor sit there and have to fill out 35 minutes worth of forms while I think the doctor should be actually working on helping to make me better, which I know you agree on with all this. But with regard to these plans, have you seen anything here from any of the candidates that you think would really, A, be able to pass, and B, be able to help save the jobs of doctors and make medical care better?
I think I do agree with Ms. McCaughey that the best thing is to get rid of the mandate. But the basic problem with all of this is that it depends on third-party insurance to administer everything. Everybody talks about health savings accounts as if that's the end-all, be-all. But patients need to understand that the insurance companies still get to decide what gets covered. The basic problem still is not addressed. And I would love to see one of these candidates ask a doctor like myself, who has to take care of patients every day, what really should be done to fix the problem. All right. And they never do.
I'm going to hammer away at that. 1 second, Betsy. I'm going to give you a chance here, Betsy, but I got to get one thing in here with the doctor. Doctor, isn't it what you said in there is something that we don't hear? Everybody's got a plan. Everybody's got an idea. Everybody's got a flow chart, but no one's asking the doctors. Can any of this help save the careers of doctors? We're losing doctors by the thousands here.
You're absolutely right. I mean, it doesn't change the regulations, all the compliance issues, the EMR fiasco that's gone on. And quite frankly, these tax credits, when you really look at it, on the front line, the bottom line, $900 tax credit or a $3,000 tax credit under Governor Walker's plan means nothing when you're spending $24,000 for a family of four and have an out-of-pocket of upwards of $10,000 of deductible. Who cares if you save $3,000 tax credit? That means nothing. You still can't afford to get labs done. You still can't afford to actually come to see me and actually get quality care.
All right, Betsy, I got a minute left, and I know you're in there. Go ahead.
These comprehensive health plans under any of these Republican alternatives. There is no mandate. So many people will wise up and say, I'm just going to buy catastrophic coverage and do exactly what Elaina wants. Pay cash when I go to the doctor, be in control of my health care. All of these plans allow that.
But here's the thing, Betsy. Why aren't the candidates talking to doctors and ask them what they think will work?
Well, you got me there. You know, politicians, they always think Washington knows best. But the fact is, repealing Obamacare will remove thousands and thousands of pages of federal regulations that are tying the hands of doctors right now. Even these new codes, Elaina, that doctors are spending weeks and weeks learning. All of that goes out with repeal of Obamacare. It will offer tremendous regulatory relief. They won't have to worry about complying with these electronic medical records requirements. All of that goes out with Obamacare.
Okay, 20 seconds left, Dr. George. If Obamacare disappeared like that tomorrow, would your life be easier?
No, actually it wouldn't, unfortunately, because the damage has been done. We have now a consortium, a consolidation of insurance companies. There's basically 3 left in the country, and they've managed to Pac-Man other ones, and now they're too big to fail.
All right.
Same thing goes with hospitals. It's all just been made huge.
Ladies, we're going to come back and do this again. We're all out of time, but I'll tell you what, we've opened up a couple things that need more discussion. Betsy McCaughey, Dr. Elaina George, thanks so much. The Hardline continues.